How would you describe yourself as a leader?
Well, I try to lead by example in terms of working hard, having integrity. That's all you have in these positions. If you lose your integrity, you don't have anything. I've always tried to identify ways to be collaborative, to pull in individuals to provide input for me, recognizing that the expertise you have typically in a group is much wiser than you individually. But identifying clearly goals and objectives concretely. I'm a bit left-brained, so that we can wrap our arms around those and find ways to be able to advance the missions in each of the dimensions of the Academic Health Center so we can improve. And the way to do that is to engage the faculty, recruit the best faculty that you have, and let them do their job and delegate appropriately so that they can be successful.
What opportunities for growth or change do you see at EVMS?
Well, one area that the hospital partnerships that are available in the region are extraordinarily strong, and I would like to see how we can help to develop those further. Recognizing there has to be a value proposition in that to be able to identify a way for the hospital partners to see how we can interface and provide benefit for their organizations and for the community. And I'd like to see how we can develop that. I was recently actually in California at Kaiser Permanente because we're starting a new campus out there actually in our medical school here in Philadelphia. And that model of care is really a model that might be identified in a way that we can develop in certain clinical areas of efficiency, collaboration, streamlined care, that I'd like to see how we can develop over time. And then certainly the research enterprise needs to continue to be invested in. It's an expensive proposition typically in academic health centers to have research because it's an investment in your academic reputation, which is essential. And Dean Pepe has recruited several very high quality chairs and researchers recently. And I want to make sure that we can support them, build upon their successful programs, and look to see how we can identify areas of research that can be built upon with other resources that we can garner.
And what do you see as some of the challenges facing EVMS?
Well, many of the challenges are the challenges that are inherent in all medical schools. The healthcare reform, whether it happens or not, is going to put pressure on efficiencies in the practice plan to deliver care the most effective way. That competition is going to create that need, that we as a faculty need to provide better care, more patient-centered care, more efficient care at a lower cost, together with our hospital partners to be able to ensure that we can do this in an integrated way, and the community faculty members as well. And identify ways so that we can improve our educational programs so that our learners can see that we walk the walk, and they can see that we're actually developing ways to be ahead of the curve and identifying ways to improve our practice so they can see what future environment they will be practicing in the future.
Do you have any ties to Hampton Roads area? What do you think about the region?
I don't have any direct ties there. My wife and I love the water and the ocean, and it's always been intriguing. I've had my eye on EVMS in my career for a long time because it really is a community-oriented medical school. And it had its roots in primary care. I'm a family doc, and there are not many family docs that are deans of medical schools, and it might be accepting of a family physician to take over as a leader. And it's a beautiful area of the country. And you know, having lived in many parts of the country, I've lived in the Northeast and the Southwest, and in Philadelphia recently here. You know, my wife and I, found the civility and the courtesy that's provided by the community in Norfolk and the Hampton Roads area just to be very embracing. And we look forward to making that our home.